Good evening, my name is Tyler Carley. I am currently enrolled at Jefferson State Community College in the Physical Therapy Assistance Program. Today's topic, we're going to be discussing Mycoplasma pneumonia. Mycoplasma pneumonia is most commonly known as walking pneumonia. This is because it is highly contagious. It's spread through droplets, which includes coughing, sneezing, wheezing, anything to do with mucus coming out of your body. And typically whenever it mimics the symptoms of a cold, so then you'll go to the doctor, and they normally take a nose and or throat culture with a swab, and they can take blood as well to confirm the infection. So what exactly is Mycoplasma pneumonia? It's considered a pulmonary infection. It's a form of pneumonia, but it's just the contagious version. It's caused from the bacteria M. pneumoniae, which is a rod-shaped bacteria, which makes it easy to move through the cilia of your nose and your throat and get stuck. So the M. pneumoniae bacteria releases toxins that mutate, and it invades the respiratory system and mutates other cells. Then it causes the inflammation in the pulmonary system. So this can decrease your mucociliary clearance. Symptoms include, but are not limited to, a very itchy throat, runny nose, secretions when sneezing, secretions when coughing, fever. Sometimes you can hear wheezing. When you go to the doctor, they'll do auscultations, and you can just hear the buildup of mucus in the lungs. Vomiting can be associated with this as well. Redness and inflammation of the nose and throat is very common as well. All right. Commonly affected age groups, it's typically children and young adults ranging from 5 to 30. And the female and male population is affected equally, so there's no variations between that. The aging process has a significant impact on this infection. So with infants and children, they have an underdeveloped immune system, which can prolong the incubation period, which exceeds the normal range. It can be deadly to newborns and infants just because their immune system is too weak to fight it off, and it'll take over. Your geriatric population can be severely affected. It can be very harmful because your immune system is decreased with age, so it's not able to fight off the infection as well. And then your lung capacity with age just decreases, and so does the elasticity to help you breathe whenever you contract this virus. Overall, there is a good prognosis if you are diagnosed with Mycoplasma pneumonia, since it is just it resembles a cold, like a respiratory infection. Most of the time, doctors will prescribe antibiotics just to kill out the bacteria, the M. pneumoniae bacteria. Some of these antibiotics include azithromycin, that is your most common. It's normally a 2-day pill, so you'll take 2 pills the first day and then 2 pills the next day. There's also tetracycline. That's typically a 5 to 7 day antibiotic. And then there is moxifloxacin, which is a 5 to 7 day antibiotic as well. As far as therapy goes, you're not going to see a patient referred to physical therapy just because they have Mycoplasma pneumonia. When treating a patient, you'll come in contact with Mycoplasma pneumonia if they've already contracted the bacteria through the droplets and inhalation. So you'll already be seeing the patient. It's common in acute care and skilled nursing facilities. So these patients won't be there just for the Mycoplasma pneumonia, but you can treat it. Respiratory therapy and postural drainage is really good for these patients. So the goal is to make a productive cough so they can cough up this mucus and its infection of bacteria, because you don't want it sitting in the lungs, because if it sits too long it can cause the patient to be bedridden, and it can cause just overall badness. It can decrease their respiratory system along with their immune system, and they can get a lot of other infections on top of this. So you want to produce a more productive cough and breathing techniques so they're able to breathe better and get enough oxygen in. When treating a patient, you want to be mindful because with Mycoplasma pneumonia, it is spread through droplets and it's highly contagious. So when you treat a patient with this, you want to wear your PPE for droplet precautions. So that includes a face mask with a shield, gloves, and then the gown to prevent any type of droplets coming in contact with your clothes. Like I said, overall, your prognosis is good. It's normally treated with antibiotics, and that's all I have for you today. Thank you.